it's Dr. Siddique. I often say that I would only recommend surgery if I was willing to do the same procedure on myself. Well, here is my patient journey story. You see, I've had back pain for years. The pain is across my low back, about where the belt sits. The pain is worse when I sit. I often get pain with activity, and I have a sore, stiff back in the morning. Occasionally, I get sciatica or nerve pain that extends down the buttock, the back of the thigh, the calf, towards the foot. I've dealt with this pain for years. I've tried everything short of surgery. I've tried injections, extensive therapy and core conditioning exercises, and occasionally I take Motrin, Advil, and or acetaminophen. Those things have not worked. This pain has gotten worse, and it's at the point now where it is preventing me from doing the activities that I enjoy. So I'm gonna have surgery. The surgery I'm having done is one that I often recommend to my own patients. That surgery is an artificial disc replacement at L5-S1. What we're gonna do is document this patient journey so I can share with you before, during, and after surgery so you can see what to expect from this type of procedure if you ever need it. This is a sagittal or side view of the lumbar spine. The belly button is there, back there, head up there, and foot down there. There are 5 vertebrae or bones in the lumbar spine. This is L1, 2, 3, 4, 5, and this is S1 or sacrum 1. There is a disc or cushion between each bone. You notice the height of this disc. This is pretty normal, as is that one. But check out the disc at the bottom segment. This disc is referred to as L5-S1 because it is in between the L5 and the S1 vertebra. See how collapsed this disc is? It's pretty much bone on bone. What we're going to do is an ADR or artificial disc replacement surgery. We'll come from the front, take out whatever disc is remaining, jack that disc base height back up to normal, and then put a fake or artificial disc in that spans from the back of the vertebra to the front.
So we are going to be doing an L5-S1 disc replacement. He has a significant disc height collapse and end plate modic changes, which means basically the disc is worn out and the height of the disc is collapsed. It actually slipped back. You have about a 2 or so millimeter retrolisthesis of L5 on S1. And we're going to clean it out, remobilize the segment, and put in a device that allows movement to be restored, with the height restored. We do believe in pain control and doing preemptive control of a pain. And one of the tools that we utilize is using ultrasound-guided blocks. What that means is that we use this ultrasound right here to look at the different muscle layers and insert and inject local anesthetic between muscle layers to decrease and mitigate the pain that is caused by skin incision.
Here, and then the blood vessels that feed the legs are behind here. So when we do a spine exposure, we make a small incision, move everything over so that Dr. Perry can see the spine. And that's what we're going to start doing now.